Hi, my name is Angelica Basso. Okay, I'm going to show you around the room. Okay, now we're going to get started. So I'm going to wash my hands. I'm going to disinfect my stethoscope. I'm going to put my gloves on. Okay, now I'm going to enter the room. Hi, my name is Angelica. I'm going to be your nurse today. Can I get your name and date of birth?
William, November 3rd, 1930.
Okay, can I confirm your name and date of birth? Can I see your wristband, I mean? Okay, now I'm going to close the curtain for privacy. Do you have any allergies?
No.
Okay, do you need to use the washroom?
No.
Okay, and am I allowed to do a head-to-toe assessment on you today?
Yes.
Okay, so I'm going to ask you some questions first. So how did your fall occur?
I was walking down the stairs and I missed a step
Okay, do you have any pain?
in this elbow.
Okay. What has made the pain better or worse?
Ice.
Ice, okay. And has the pain gotten better or worse in the last 2 days?
A little bit better.
Okay. And was there anyone around you when you fell?
No.
Have you had any prior falls?
No.
Okay, and are you taking any medication?
No.
Okay. And what were you wearing on your feet?
I was wearing socks.
Okay. And do you use any assisted devices when walking?
No.
Okay. And is anyone at home able to care for you?
Yes, my wife and kid.
Okay. Now I'm going to do a general survey. So looking at her appearance, she appears to be her stated age. It appears to have even skin color and tone. Now looking at her body structure, can I have you stand up? So her weight appears to be in normal range, and so is her height. You can sit down. Body parts appear proportionate to each other, and no physical deformities. Looking at her behavior, speech is clear and understandable, mood is comfortable, hygiene appears to be clean, and clothing is appropriate for climate. Can I have you walk? Gait is well balanced and normal. You can sit down. Work of breathing appears normal and no signs of distress. Level of consciousness is alert. And can I ask you where we are right now?
At a clinic.
Okay, and can I ask you what the date is?
August 13th.
Okay, person appears to know place or time. Now I'm going to look at her head. Size appears to be the proportionate. It feels symmetrical and smooth. No lesions or lumps. No pain when touched. Now I'm going to look at her hair. Hair appears blonde in color and texture, feels thick. A lot of quantity of hair and no infestation. So now I'm going to look at her facial structure. Face appears symmetrical. No swelling, no involuntary movements, and no scars. Okay. And now I'm going to ask you to smile, show teeth, frown, lift eyebrow, shut your eyes, and puff out your cheeks. Okay. So cranial nerve 7 appears intact and is symmetrical. Now we're going to look at your eyes. So let me grab this. So your eye color appears green. Can you close your eyes? Lashes appear to be evenly distributed and no lid leg when opening and closing eye. Upper eyelid overlaps lower eyelid. No discharge. No crusting in corners. Sclera appears white in color. And conjunctiva appears clear. And I'm going to shine a light in both your eyes. So left and right pupil appear symmetrical and both constrict with light. Now I'm going to do the direct light reflex. Let's do the right eye first. So pupil appears to constrict as normal. And now I'm going to do your left eye. So left eye constricts as normal as well. So perfect. So now we're going to do the consensual light reflex. So for the right eye, I'm going to I'm going to shine it on the left eye, and then I'm going to look at the right eye. Right eye appears to constrict as normal, and now I'm going to look at the left eye. So I'm going to shine a light on the right eye, and then look at the left eye. Appears normal, and both are symmetrical. So now I'm going to have my pen. I'm going to have it as a distance, and I'm going to bring it closer. So pupils appear equal, round, and react to light and accommodate. Now I'm going to do the cardinal gaze. So I'm going to have you follow the light. 3 on the right, left side. Okay. 1, 2, 3. Okay. That's good. So cardinal gaze appears smooth and normal. And now I'm going to do the confrontation test. So we're going to cover the same eye. So let's cover this eye first. And then I want to ask you to say now when you see the hand. Ready? Okay. No. 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 Okay. And now we're going to do the same for the other eye. So let's cover it. Okay. Ready? No. 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 Okay. Appears normal. Great. So now we're going to get the smelling chart. I'm going to ask you to close your left eye and let me know what's the last line that you see.
63925 ME3X0X85.
Okay? So your eyesight appears to be 20/50 in your right eye. So I'm going to ask you to close your right eye now and do the same thing for your left eye.
63925 ME3X0X85.
Okay? So it appears that your left eye is also at 20/50. So, all right. So now we're going to look at your ears. So the color appears the same, and both ears appear symmetrical. No discharge, and shape is normal on either side. Now I'm going to touch the auricle. Appears normal for both ears and no pain. And then we're going to check your tragus. Appears to be normal, appears to have no pain on both sides. Okay, and now we're going to do the whisper test. So I'm going to whisper 3 words on your right side first, and you let me know what you hear.
Dog, bird, cat.
Great, okay, and now we're going to do the same thing for the left side.
Black, blue, orange.
Okay, perfect. So whisper test has been passed. Now I'm going to get my otoscope. Now look at the external canal. In the right ear, pull the pinna back and up. No redness or discharge. In the external canal, tympanic membrane appears shiny gray, no bulging and no holes. And now I'm going to do the same thing for the left ear. Pinna up and out. Okay, no redness or discharge in the external canal. And then in the tympanic membrane, appears shiny, no bulging and no holes. Okay, so now I'm going to do the Weber test. So I'm going to bring this and put it on your head. Let me know if you feel the vibrations and you hear them in both ears.
Yes.
You do, and let me know when it stops.
Stop.
Okay? Okay, so your perception appears to be intact. Now I'm going to do the Rhine test. So I'm going to place this tuning fork on your mastoid bone, and then I'm going to put it to your ear after, and then let me know when you don't hear the sound anymore on your mastoid bone, okay?
Mm-hmm.
Let me know when you stop hearing it.
Stop.
Stop hearing it? Okay, now I'm going to put it close to your ear. Let me know when you don't hear it anymore either.
Stop.
Okay, so now I'm going to do that with the left side as well. Tell me when you stop hearing it.
Stop.
Okay, and now I'm going to put it beside your ear. Tell me when you stop doing it.
Stop.
Okay. So cranial nerve 8 appears to be intact. So now I'm going to do your mouth. So your lips appear to have no, sorry, I'm going to do your nose first. Nose appears to have no crusting or discharge. Breathe in. Primacy appears to be normal. I'm going to check your sinuses. Frontal sinus, did you have any pain?
No.
Maxillary sinus, do you have any pain?
No.
Okay. I'm going to hold your right nostril. I want you to breathe in with your left and let me know if you can breathe.
Yeah.
Okay, I'm going to do the same for your left.
Yeah.
Okay. Okay, I'm going to have you close your eyes and hold your right, close both eyes and hold your right nose. And let me know. Try to guess the smell?
Coffee.
Okay. And then I'm going to have you do the same for the other. Make sure both eyes are closed. Okay. What do you smell?
Chocolate.
Perfect. Okay, so the cranial nerve 1 is intact. So now I'm going to look at the mouth. So your lips appear pinkish in color and no lesions. Let's check your gums. Gums appear to have no bleeding and no lesions. Let's check your teeth. Color is white and appears to have all teeth. Okay, let's check your tonsils. Open your mouth. Tongue out. Grade 1 as visible for tonsils and appear to be pinkish in color. Can I have you stick out your tongue and up? Okay. Color in tongue appears pinkish and normal and no lesions. Let's take a look at your hard and soft palate. Open up again. Okay, so color on both appears pinkish and doesn't have any lesions. I'm going to have you say ah. Okay. Uvula and soft palate appear to both rise. So cranial 9 and 10 appear to be intact. I'm going to have you stick out your tongue and say light, tight, dynamite.
Light, tight, dynamite.
Okay, now I'm going to have you move it to the right and say the same.
Light, tight, dynamite.
And now I'm going to have you move to the other side.
Light, tight, dynamite.
Okay, and appears to have no tremors. So cranial nerve 12 is intact. Now I'm going to look at your neck. So color appears normal to skin tone, appears symmetrical. Appears to have no visible masses. Tracheal position is normal. No obvious enlargement of thyroid. No scars and no lesions. Okay? Now I'm going to check your carotid artery. Let's check your right side first. So rhythm appears normal, grade 2. And now I'm going to check your left side. Rhythm appears normal and grade 2. So it appears equal bilaterally on either side. Now I'm going to have you rotate your head against resistance. Okay, and I'm going to have you do the same thing as on the other side as well. I'm going to have you shoulder your shoulders against resistance. Good. Appears that your cranial nerve 11 is intact. Now I'm going to look at your upper extremities, so your fingers, your wrists, your elbows, and your shoulders. Appears to be symmetrical. And no muscular atrophy, no joint inflammation. Okay. Elbows. Right elbow appears to be a little bit swollen, but muscle bulk is proportioned. No swelling anywhere but the elbow, right elbow. No lesions, no scars, and a color appears to be normal. Now I'm going to palpate them. Skin temperature appears warm to touch. Turgor appears normal. Appears to be a bit of pain in the right elbow. Joint temperature appears normal. No swelling other than the elbow. Moisture in skin appears normal. Muscle bulk still feels proportionate. No masses. I'm going to press on your nails. Color returns to nail in 1 second. Capillary refill is normal. Nail is slightly curved, and that's normal. Nails feel smooth and round and no lesions. And now I'm gonna have you follow me. So flexion, extension, wrist flexion, extension, wrist radial and ulnar. Then we're gonna do elbow, flexion and extension. And then we're also gonna do elbows supination and pronation. And then we're gonna do a shoulder shrug. And then we're gonna do shoulder abduction and then adduction. And then we're going to do shoulder internal rotation and external rotation. Okay, appears to have no pain and no crepitus. Appears to be normal. Let's check your radial pulse. Rate appears normal and rhythm is regular. Quality appears normal. Let's check the other side. Rate is normal, rhythm is regular, and quality is normal. So equals on both sides. I'm going to ask you to grab my hands and squeeze them. Okay, it appears to be normal, your hand grip. Now we're going to look at your lower extremities, which is your hips, your knees, your ankles, your foot, your spine. So your color appears to be equal, appears symmetrical for all of them. No deformities. Joints don't appear to be inflamed, no swelling. And now I'm going to palpate it. Turgor appears normal. No pain, texture is smooth. Temperature is warm to touch. Joint temperature is normal. Joints don't appear inflamed and no masses and no swelling. Now I'm going to do the dorsalis pedis pulse on your right foot. Okay, regular rhythm, grade 2. And now I'm going to do the left foot as well. Regular rhythm, grade 2. Equal on both feet. And now I'm going to do the posterior pedalis. Regular rhythm in grade 2. And then I'm going to do the same thing for the left side. Regular rhythm in grade 2. Equal for both feet. Now I'm going to have you follow me. Dorsiflexion, plantar flexion. Okay, appears to have strong and equal bilaterally. Now, we're going to look at your posterior thorax if you want to turn around. Thorax symmetrical with ribs, no skeletal deformities. Respiratory rhythm appears normal, no pulsations. The moisture appears normal, no lesion, no scars, and the color appears normal. Let's check your ratio. Your APT ratio appears to be 1 to 2. Now I'm going to palpate it. Can you take a deep breath? Do you feel any pain?
No.
Turgor appears to be normal. No masses and no lesions. Now I'm going to be doing the tactile fremitus. So say 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99, 99,
99,
99,
99,
99.
99.
Okay. So symmetrical expansion appears to be normal. So now I'm going to percuss your posterior thorax now. Appears to have no dullness and appears to be clear and hollow. Okay, and now I'm going to listen with my stethoscope for your brachiovascular and vascular. Breathe in. Okay. Bronchial and vascular breath sounds are equal during inspiration and expiration. Appears to have no wheezing and crackles and moderate pitch. And then the vascular appears to have more during inspiration and stops at expiration. No wheezing or crackles. Low, and it appears to be more of a low soft pitch. So your respirations appear to have a normal rate, a regular rhythm, and quality is normal. So if you could turn around now, I'm going to listen with my stethoscope to listen to your valves. So So we're going to listen to the aortic valve, the pulmonic valve, the the mitral valve, and then the tricuspid valve. Now I'm going to hear the S1 and S2 sound. So S1 is louder in the apex and S2 is louder at the base. So S1 is love and S2 is dub. And now I'm going to hear the stethoscope to hear the heart rate. Appears normal. Strength is strong, rhythm is regular. And now I'm going to use the back of my stethoscope to hear if there's any extra sounds. So it doesn't appear that there's any S3, S4, or murmurs. Can I see your abdomen? Okay. So umbilicus appears midline and inverted. No discoloration. No stride. Demeanor is relaxed. No scars. No lesions. Now I'm going to listen to the sounds of the quadrants. And now I'm going to use the smaller part of my stethoscope to hear if there's any root sounds in the aortic, the left renal, the right renal, the left ilia, the right ilia, the left femoral, and the right femoral. I'm going to percuss the 4 quadrants. Appears to be normal. And now I'm going to palpate the 4 quadrants. Appears to have no tenderness, no masses, no pulsations. She appears to not guard, and there's no rigidity. So now I'm going to look at Murphy's sign. So I'm going to hold my finger under the liver, and I'm going to ask you to take a deep breath. Do you feel any pain?
No.
Okay. Now I'm going to look at the blue Murphy sign. So I'm going to push down slow and deep. Do you have any pain?
No.
Appears to be normal. So now I'm going to look at your sensations if you don't mind sitting up. So I'm going to have you close your eyes, and I'm going to use a cotton ball, and I'm going to touch areas of your body, and you let me know where you feel it.
My shoulder,
Which side?
right.
Okay.
Left elbow,
Okay.
right foot, left foot, left shoulder.
Perfect. Okay, now I'm going to ask you to close your eyes again and tell me if you feel something sharp or dull.
Dull. Dull. Dull.
Sure. Sure. Perfect. Now I'm going to place an object in your right hand, and you let me know what it is.
A coin.
Perfect. Now I'm going to ask you to do the same thing for the left side, and you let me know. It's going to be a different object.
A Q-tip.
Okay? Serogenesis appears to be normal and appears to be passed. So I'm going to have you close your eyes again. I'm going to move your finger up and down if you don't mind giving it to me. Let me know if it's up or down.
Up.
Okay? And let me do that with the other hand.
Down.
Perfect. So position sense appears to be normal. So now we're going to do the bicep reflex. Here's normal. Now we're going to do the tricep. Here's normal. Now we're going to do the brachial ardalis. Okay. Now I'm going to do the patellar. You can let your legs dangle. Ready? Okay, appears to be normal. And I'm going to do a J shape at the bottom of your foot. Okay. Now we're going to do balance. So we're going to do the Romberg test. So I'm going to have you stand up with your eyes closed. Just stand there. So after 20 seconds, she didn't move, so that means she has balance and it is normal. I'm going to have you do the Tatum walking. If you could walk like this. Here's normal. Can you walk on your toes? Here's normal. And can you walk on your heels? Now we're going to do the pronator drift. I'm gonna have you stand like this with your eyes closed. After 20 seconds, it appears that she hasn't moved her hands, so it is normal. Okay, you can sit down. I'm gonna have the doctor come in and see you. Thank you so much. If you have any questions, just let me know, and you can just call me, and I'll be able to help you. Okay? Thank you.